The popliteal fossa. Popliteal fossa is a diamond space behind the knee joint formed between muscles in the posterior compartment of thigh and leg. So we are discussing about the boundaries of the popliteal fossa. Now we are talking about the skin of the popliteal fossa. The skin of the popliteal fossa refers to area behind the knee where the skin is thin and delicate. It is prone to irritation and can be sensitive due to underlying structures such as nerves, blood vessels, and tendons. This skin area is important for protecting these structures. Now we are talking about the subcutaneous fat. In the subcutaneous fat, the branches of the posterior cutaneous femoral nerve start from sacral plexus.
A thin layer of superficial fascia separates the tissue from its own fascia. The superficial fascia has no features. The own fascia is called popliteal fascia. The popliteal fascia is a continuation of the fascia lata. The density of the popliteal fascia is comparable to the aponeurosis. This prevents the determination of the pulse in the popliteal artery in an extended position of the limbs.
First, superior medial, we have semimembranous muscles. It starts from ischial tuberosity of inferior pelvis and end in distal part of popliteal fossa. Now we have semimembranous muscle. It also starts from ischial tuberosity and end in medial surface of popliteal fossa. Now it is supplementary gracilis muscles, sartorius muscles, and also we have abductor magnus muscles. Now, we on superior lateral we have biceps femoris muscles. It starts from ischial tuberosity and end in linea aspera of femur. Now we have on inferior medially and inferior laterally we have gastrocnemius muscles. It starts from supplemented by plantaris muscles. Now we are discussing about the floor of the popliteal fossa. Floor contains flowing features. Now floor we have popliteal fossa, posterior surface of knee joint capsules, popliteal muscles and posterior femur. In the middle of the area we have popliteal lymph nodes.
The popliteal artery is a direct continuation of the femoral artery. In the popliteal fossa, popliteal artery is located on the bone and posterior surface of the articular capsule, anterior and medial to the popliteal vein. Further down, the artery lies on the posterior surface of popliteal muscle, covered with heads gastrocnemius muscles, and then, going under the edge of soleus muscle, is divided into its two terminal branches, arteria tibialis anterior and posterior. In the area of popliteal fossa, the following branches branch off from the popliteal artery. There are arteria genus inferior lateralis, arteria genus inferior medialis. Vena saphena parva is located into the lower part of the region, in the split of the own fascia between the heads of gastrocnemius muscles, and at the level beginning, the gastrocnemius muscle vena saphena parva flows into the popliteal vein.
In the subcutaneous fat, the branches of posterior cutaneous femoral nerve start from sacral plexus. Also we have of the thigh reaches the articular line border with the anterior region that is called as femoral nerve start from sacral plexus too.
Cutaneous nerve with vena saphena parva runs into the groove between the heads of gastrocnemius muscles, and on the lower leg it exists through the splitting of its own fascia into the subcutaneous tissue and connects with nervus cutaneus, suria lateralis, into the sural nerve. The common peroneal nerve runs from the proximal apex of the popliteal fossa to its lateral side. The common peroneal nerve is located under the medial edge of the biceps femoris muscle, between it and the lateral head of the gastrocnemius muscle, spiraling around the head of the fibula, being covered here only by fascia and skin. The tibial nerve begins at the top of the popliteal fossa, follows almost to its distal angle. The tibial nerve is located in the area of the fossa under the fascia, between it and between the popliteal vessels. The tibial nerve runs between the heads of the gastrocnemius muscle, lies on the posterior surface of the popliteal muscle, and accompanied by the posterior tibial vessels, passes under the tendinosus arch of the soleus muscle, being here covered by this muscle.
Ways of spreading pus. Number 1. The cellular space
of the popliteal fossa along the sciatic nerve communicates with the posterior bed of the sea. Number 2. Along the course of the femoral vessels, the fiber is connected through the adductor canal with the anterior region of the sea up to the fiber on the femoral triangle. Number 3. Along the popliteal vessels and tibial nerve, fiber is connected to the deep space of the posterior region of the leg.